Hello, everyone. So, my country that I was given was Cuba, and the leading cause of death was cancer. So, my presentation is over lung cancer in Cuba. So, go. Okay, so a little overview about the disease. So, cancer contributes to 25% of all deaths in Cuba. In adult men, the most common diagnoses are lung, prostate, and colon cancer, while in adult women, the most common diagnoses or forms of cancer are lung, breast, and colon cancer. About 60% of the population over 60 years of age is affected by the disease. 78.8% of deaths are from cancer, and 66.8% of new cases come from this age group. In 2015, the crude incidence of cancer among Cubans was 425.6 per 100,000 adult male inhabitants and 366.7 per 100,000 adult female inhabitants. So, as we can see, lung cancer is the most common form of cancer among the adult male and female population. So, that is what I will be discussing a little bit further. So, Cuba's healthcare system. Following the revolution in Cuba, the healthcare system began a massive transformation in 1959. So, Cuba has a universal free healthcare system for all of its citizens, and much of that is based on working with those who are in poverty and also encouraging community participation in primary health care. The CCP, or Comprehensive Cancer Control Program, is responsible for treatment, prevention, and education of cancer. Now, the CCCP was actually a is a previous it was under a previous name, and so in 2006 it was actually reorganized to become the CCP or CCCP. Sorry, it's kind of a tongue twister. And so their main goal was to reorganize the healthcare system so that there was more cancer education, there was more access within the general public for free screenings, and there was also more of a treatment plan and education so that people were more well informed of what kind of cancer they had and then ways to treat it. And also, the good thing about Cuba in their universal healthcare is it's all covered by the country. So the citizens do pay for it, of course, but it's universal healthcare, so it's not as costly as, say, like the United States. The approach to the treatment and prevention of cancer is through both primary and secondary means. So, primary prevention, specifically for lung cancer, the CEMAVAX EGF vaccine was designed in Cuba and is specifically for those who have stage 3B or 4 non-small cell lung cancer. So, essentially, what this vaccine does, it is a vaccine that it encourages the body to release its own antibodies against the cells that encourage malignant tumor growth in the lungs. And it has been found to be very successful. And it also has improved the quality of life among the citizens who have taken it. And also another big thing for prevention is through secondary prevention, which is early detection through screenings for healthy individuals, targeted individuals, so like those at risk, and asymptomatic patients. And so what I really like about Cuba in their healthcare system is they encourage screenings for those who are healthy. So even if you don't believe that you may have any symptoms, they really want you to get that screening, just kind of be on the safe side. And just in case you have any questions or concerns, you get those questions or concerns alleviated by getting that free screening. And so, in comparison, the United States healthcare system and how they take care of the patients with lung cancer. So, the US healthcare system is comprised of public and private insurers, and also federally mandated providers. So, Medicaid and Medicare are the two primary federally mandated providers. Approximately 92% of Americans are covered by health insurance, which leaves about 7.5 million Americans who are uninsured. And so, with that, the price tag on healthcare in the United States is quite expensive, whether you are uninsured or insured. And in the United States, lung cancer is actually the leading cause of cancer death. It is also the costliest form of cancer. Cancer patients often pay 4 times as much in medical related costs than those who are not diagnosed. So, say like regular patients versus cancer patients, that cost is almost 4 times higher for those with cancer in their medical expenses. The country has more of a treatment approach, so they offer routes such as chemotherapy, surgery, as well as radiation therapy. So, chemotherapy can also be considered as a route of prevention against cancer because it is known to slow the growth of malignant tumors, whether that is in your lungs or in any other form of cancer. It's been known to kind of slow down the rate of growth of tumors. And also, the other main form of prevention in the United States is encouraging their citizens to stop smoking cigarettes, as there is a correlation with smoking and the risk of lung cancer. Also, risks of lung cancer in the United States are like with chemicals, such I think as like rayon, like exposure to rayon, definitely increases your risk of lung cancer. And also like other environmental like pesticides and repellents and like just like really harsh heavy chemicals and working with those, you have a higher risk of lung cancer. So they really encourage like safety and protection in those like work related fields or just in general if you're working with those chemicals to really protect yourself. So, how do the two compare in the treatment and prevention of lung cancer and also just cancer in general? So, the two healthcare systems differentiate through many aspects. Cuba has affordable universal healthcare, excuse me, while the United States has either public or private insurance or federally assistant programs. Federally assisted programs. Cuba maintains a prevention approach by encouraging early detection screenings while the United States encourages treatment. Cuba has a vaccination that is specifically designed for treating non-small cell lung cancer, while the United States does not. I have actually read articles in which citizens from the United States who have non-small cell lung cancer, that is also a tongue twister, they have actually traveled to Cuba in order to receive this vaccination since it is not approved quite yet in the United States, I believe, to be fairly mandated and applied clinically. Also, both countries do have like cancer research. So like in the United States, we have like the National Cancer like Research Institute, and then Cuba has their CCCP. So they also both have like programs that are run by the country or like a federally like the government in order to further research and further treatment and prevention of cancer. So yeah, if you guys have any questions, let me know. These are my references. I just wanted to include them in my presentation to kind of cite where all my information came from. Again, if you have any questions, feel free to ask them in the discussion post. And thank you for listening.